Coming up next is Dr. Kimberly Taylor. You can listen live on the internet at drkimtaylorshow.com. Here now is Dr. Kimberly Taylor.
I'm glad to be with you today. We are going to be talking about the recent tragedy in Isla Vista. You may be asking, how could this happen? And struggling to understand why. There may never be satisfactory answers to these questions. But what I do know for sure is no one who sees a tragedy like this is untouched by it. Whether you are a student, parent, teacher, a family member, a friend, or a neighbor, we are all greatly affected. Today I have 3 guests here. First, it's Dr. Geis Reyes. He's an expert in crisis management and intervention, and he's going to guide us in how to cope with these recent events and how we can manage the feelings that everyone is having. Next, we're going to talk to Dr. Marjorie Geis, who is a local psychiatrist, and we will discuss the signs and symptoms to recognize in someone who may be escalating and therefore needing more professional help. And lastly, State Senator Hannah-Beth Jackson will be with us to talk about possible legislative changes that need to be made for the future. Now, there's no easy and quick answers, but this kind of incident is no longer an exception in our lives. We live in a culture that embraces violence and mayhem. On our television sets, in our movie theaters, in our news, and even our entertainment games that we give to our children. We must find a way to make some changes. I want to welcome Dr. Geis Reyes. He is a clinical psychologist and an expert in crisis management and post-traumatic stress with both children and adults. Welcome to the program.
Thank you for having me. It's an honor and a privilege.
I would really like to talk about how to help those who have been affected by the recent shootings in Isla Vista, and that we know that for those who have been involved in this kind of event, that they can have a variety of emotions right after. And so what should they expect?
Well, what they should expect is that they're going to feel a lot of feelings. They're going to feel a sense of stress, a sense of loss. They may not feel traumatized, and that's a good thing. No one wants that to happen to anyone. But they're going to bear a little extra stress or a lot of extra stress depending on how personally affected they are by this. People are personally affected oftentimes because they know and care for or love someone who's been killed or injured. Sometimes they're really stressed because they identify with those people, because they went to that school, or they used to live in that neighborhood, or any number of other things that cause us to feel close to people we don't really know. Sometimes they're just very deep-feeling people. They're highly compassionate and empathic, and so these things have a tendency to be felt with some intensity and can last for a long time.
So they can be experiencing a lot of profound sadness and worry and a lot of numbness in some cases. And this is also going to affect perhaps their eating or sleeping or their ability to relax. What is the time frame and what should people expect when they're dealing with these kinds of feelings?
Well, the time frame is going to vary a great deal. And one of the things that I get concerned about, along with the time frame, is what is this doing to their day-to-day functioning? So there are a number of feelings that they're going to feel. Is it intruding in their memory? Are they having memories of things they saw or things that they heard? This is a very serious sign. To feel sad typically is not a very alarming sign. To feel a sense of loss or to feel a sense of outrage about a terrible event, again, not a very alarming sign. But what if it's altogether too present throughout your day? And then, as you mentioned, trouble sleeping, trouble eating, that your life is being affected in very tangible ways. If you can't get something like this off your mind, that's a pretty alarming sign. Now, if it's on your mind a lot for the first few hours or the first even few days after the event, but it isn't keeping you from sleeping, it's not something you're waking up in the middle of the night thinking about, and it's not the first thing you find yourself thinking about when you awake in the morning, then that's not so alarming, and that's likely to pass rather quickly. So my message would be, the longer this goes on, and the more pervasive across a given day and night that it is, the more it would concern me.
And what are some of the things that people can do to actually foster their own recovery?
Well, I would say that the first thing that they can do is to be compassionate with themselves. That if they're feeling these things, you might call it self-compassion, self-empathy. Be kind to yourself. Don't beat up on yourself about things. And try to have some sense of control and volition about what you allow yourself to feel and for how long. It's okay for you to feel your feelings. If you feel outraged, well, who wouldn't be? If you feel angry, well, so am I. But the longer we dwell there, the more that pushes out other things in our lives and colors events in our lives. And we can find ourselves then feeling soured, embittered. We can find ourselves dwelling on the dark side of life and missing so much goodness all around us. And so we need a balanced diet of what we're exposing ourselves to emotionally and in our life experiences. So being isolated, being withdrawn, those are not helpful. Reaching out to others, being willing to take a hug or give a hug or whatever your equivalent of that might be. Because one of the things that makes us feel good about life is to know that there are good people in our lives. And another thing that makes us feel good is to know that we're good people and other people know that about us. So one of the ways that I recommend that people cope with extreme stress is sometimes to do something kind for someone else. Because when you know that you have something to offer to another person to make their day a little brighter, it comes right back to you.
And I think those are all really great points that you have made, and being able to really spend the time with family members or close friends and really talking about this and letting your feelings out so that you really truly can process it while it's right there and not hold on to that. I think that is a very big point probably for all of this in a way to take care of yourself. I will be right back with Dr. Gil Reyes right after the break. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. We are back with Dr. Gil Reyes. He's a clinical psychologist and an expert in crisis management and dealing with post-traumatic stress, especially with children and adults. So, Dr. Reyes, I have a question for you about some people who have gone through this trauma, who are going to start to feel guilty, even guilty about surviving, or perhaps that they didn't do more, or even they're going to want to have someone to blame. So what would you say to these people?
Well, the first thing I would say is that that's completely understandable. This is the kind of event that brings those feelings out in a person. And it shows that they're a good-hearted person. They have a sense of justice. They have a sense of connectedness with other people, and they want things to go well, and they want to be part of the solution. Why does a person feel guilty sometimes when they themselves personally didn't do anything wrong? It's because they have a sense of social responsibility, and they're asking themselves, what could I have done differently, and what can I learn from this that I can take forward in life so that I can be part of preventing these kinds of things from happening again.
What I do know is that we are not completely sure about why some people are more resilient after something like this, but are there some common traits of people who do bounce back from this a little better than others?
Yeah, the ability to bounce during hard times seems to have a lot to do, first and foremost, with a person's perspective on the world and where they fit in. So we talk of this in terms of optimism, and we don't mean that the person is naive, unaware of the severity of events or anything of the sort, but that they tend to see the opportunity for making the best of a situation and being one of the people who will take some initiative to make life better for themselves and for others. So that leads me from optimism to a sense of social connectedness, that this person feels that they have other people in their lives who genuinely love and care for them, and that they can also be there for those people. So that social connectedness is important. We also vary in what is sometimes called our cognitive flexibility or cognitive rigidity, the opposite of flexibility. If we're more rigid in our beliefs and our ways of thinking about that, it may feel as though we're armored and we're hardened to things. But unfortunately, that can be an illusion. And in fact, what we might be is more brittle or less able to incorporate new and important information into our understanding of situations and our place in those situations. So some flexibility is certainly very important. And finally, I would say that there are lifestyle choices that we make that you might label simply healthy living, that we're taking care of our needs for sleep and rest, for recreation. And sometimes what we'll see that people do instead is they throw themselves into too much work and they're having trouble taking care of themselves and getting enough rest, that kind of thing. And it just adds to their stress burden. And one of the things that really takes the stress off is to relax. If I injured myself, if I fell off of my road bike today and fell on the road and injured myself, then I would certainly go see a professional who could help me heal more quickly. And there's no shame in that. And I know that sometimes people feel that it's easier to go to a doctor with a broken bone or a strained muscle than it is to go and see an equally competent professional who can help us to cope with some of the stress burden and feelings and trauma that we're experiencing, the grief and the loss. But there's absolutely no shame in that. It's part of taking care of yourself. And if anyone out there lacks the funding, doesn't think that's affordable, then I want you to know that the Santa Barbara County Psychological Association is posting a list of people who are offering their services to anyone who needs help. And I believe that some, if not all of that, is pro bono, meaning free of charge. Certainly others will do it on a sliding scale. I also know that there are the University of California in Santa Barbara City College. They're providing services to their students. There's a group that I'm involved with called the Santa Barbara Response Network that's going to be providing a compassion center and compassion patrols out in the Isla Vista neighborhoods. So, we have a tremendously good-hearted community here. I'm
actually going to have all of that contact info on my website, and I will have, whether it's the phone number or the website for them to go to, they can go to my website to find that, and I'll post that at the end of the show.
you are one of the great resources that I was listing, and thank you so much for what you're doing for this community.
Thanks very much for coming on to share your expertise in this, too. It's very valued. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. Hi, I'm here now with Dr. Marjorie Geis. She is a board-certified psychiatrist. Welcome to the program.
Thank you. It's nice to be here.
I really wanted you to come on because I know that everyone out there at this time is really wanting to know, why does this type of incident happen? And we really want to know, what is the mindset or a psychological profile of someone who is capable of doing something like this? Are there red flags that we can look for?
Firstly, I'd like to say that mass murderers are angry, dissatisfied people with poor social skills or few friends. 96.5% are male, and the majority aren't clinically psychotic. I'd say 1 out of 8 are what we would deem insane. The others are social misfits or angry loners. Many have paranoia and acute behavioral or personality disorders, specifically antisocial personality disorder or narcissistic personality disorder, what a lot of people loosely would call psychopaths. Jealousy is a subtype of paranoia. It's not necessarily a psychosis. These loners are often tipped over into ungovernable rage by an event. So in terms of flags, I think we would see a pattern of increasing isolation, perhaps depression, angry rumination, thought processes that are getting fixed, and delusional, perhaps. So watch their thinking and thought process. Mm-hmm. And then it could be an event that would tip them over into acting.
It is something that is built up. It certainly isn't something that just happened. This was something that was over a long period of time. So what are perhaps some of the more early signs and symptoms that parents and those around these people should be more aware of, and that they should then seek some kind of help for?
If there is a pattern of isolation, being withdrawn, difficulty making and keeping friendships, kids who've been bullied and taunted during their school years, feelings of powerlessness and despair, anger and rage that have been building. If you see cruelty to animals or wanton disregard for the feelings of others, I think those are big flags for parents and friends to look out for.
If some child is going through this and they get to the point that there's throughout the years that their frustration increases and increases, then it could lead them to want to seek revenge on others and to do harm and to inflict pain.
Yes.
One of the questions that I had is that the whole topic of Asperger's syndrome has come up, and is there something that you can tell us about that? Because I think it's important that not all people who have this are going to be violent, and I think it's important that we spread that word, that it's not all people.
Well, Asperger's they're individuals who have trouble socially and difficulty reading nonverbal signals and picking up the subtle language of human relatedness. So they tend to be isolated or bullied or taunted because they're outsiders. They're often, kids might feel uncomfortable around them because they're not picking up the subtle language of the nonverbal. But that doesn't make them violent by any means. It might make them hurt or sad or depressed. But this young man had multiple things going on. And we need to come at these issues from a perspective of complexity, of looking at the big picture, and not slip into the tendency to be reductionistic or try to find simple solutions.
So if someone is seeing some of these red flags, let's just talk about family members, if they're seeing some of these red flags that you spoke about and seeing someone who is withdrawn, has difficulty bonding, attaching to others, making friends, that they're being bullied, or that they have this sense of despair and that they're wanting to seek revenge, what should family members do?
Family members should definitely take their loved one to be assessed by a psychologist or a psychiatrist who can assess, come up with a diagnosis, or get additional testing as needed.
And tell us, what is that difference between a psychologist and a psychiatrist? You are a psychiatrist, so I think it's really important to kind of keep that clear, because that is something that does get confused.
So a psychiatrist went to medical school and got a medical degree before they went on to their psychiatric study. So that would be 4 years of medical school, 1 year of internal medicine, and then 3 years of psychiatry. And some go on to specialize, for example, in child and adolescent would be a further degree, or geriatric, or addiction, or psychoanalysis. Psychologists go from their undergraduate work into a 5 to 7 year doctorate program, and then often spend additional couple years getting their hours, or which is certainly a rigorous process, but psychologists cannot prescribe medication in most states, and psychiatrists have the medical background to first look at the mind-body relationship and try to discern if there is a medical component or a medical illness or endocrine, etc., to the symptoms that the individual is presenting with. I'd say also psychiatrists come at it from the framework of conceptualizing a nervous system. You know, what is, in terms of a whole body, but what is this person struggling with in terms of their nervous system?
And I think that the next thing that we need to step to is also, why see a psychiatrist as opposed to just going to your general MD?
Well, psychiatrists are specialists in assessing, diagnosing, treating mental illness. So they are more attuned to conditions. They set aside the time to tease apart differential diagnoses. I'd also say that we're experts at the interviewing process in terms of creating an alliance, starting with open-ended questions that can help them to track people's cognition and see what they generate on their own, and then honing in with closed-ended questions. We also listen carefully to what is being unsaid, what is unspoken, and we always ask about potential delusional system questions, any suicidal ideation, homicidal ideation, ideas of reference, etc. So we also look at what's going on subtly, and ask the kinds of questions that honestly general MDs just don't have the time to ask.
Okay, and then on top of all of that, you day in and day out work with medications, and so you can more closely monitor what kind of symptoms to treat, and not just treat a general depression or a general anxiety.
Yes, I think we have a larger toolbox to work from in terms of the variety of medications that we can use to help people. We understand dosing, that some people need extremely low doses, some people need higher doses. We understand side effects, which side effects work for you, which work against you, and sometimes need to come up with a cocktail to help people that one size fits all often doesn't work.
So someone like this who really needs to be managed well, and they need to have probably a team, whether it's therapists and psychiatrists, that can help them to monitor the complexity of the kind of symptoms that this person has. if we're talking about family members, it's best that they get that kind of help. But I also wanted to switch a bit. And what would you say to students when they see other friends or students in their schools that they're exhibiting some of these behaviors, that they're acting a little odd, that they're not making friends, that they can see that they don't fit in, that they may be a little bizarre? What are some of the things that they can do to perhaps protect themselves, but also to help this person?
I'd say definitely reach out to authority figures or administration. It could be starting with your RA. Go to the counseling center. If your roommate is cooperative, say, let's go together, or go and meet with a counselor alone and express your concerns, but don't stay silent. I would definitely speak up and reach out to authority figures.
And is there anything that you would say to actually those people who might be experiencing a sense of being lost, of feeling like they're getting more and more frustrated, that they're getting more and more angry, that they're thinking about doing harm to others? Is there anything that you can say to them?
First of all, these feelings are, on a wide range of feelings, are part of the human condition and normal experience. So feelings in and of themselves aren't good or bad. But I encourage those people to go talk to someone to try to make sense of their experience and move forward in a constructive fashion. But seek help.
So let's review for a minute. What are some of the early signs and symptoms that someone may be in trouble?
Isolation, becoming increasingly withdrawn, anger, lashing out verbally or physically, self-cutting, self-harm, evidence of some sort of paranoid thinking or sort of delusional ideas, describing, commenting that people are against them or trying to hurt them or harm them, and then feelings of powerlessness or despair, shutting down, not getting out of bed, dark room. And substance abuse can also be a big flag, a huge precipitant to impulsivity or acts of desperation.
And is there anything that you would recommend for those who are actually watching this all happen and perhaps watching the news over and over and starting to get very anxious and agitated or depressed about this?
They definitely should reach out for help themselves. It's very normal for events like this to be unsettling, to disturb sleep and a sense of safety in the world, and seek out yourself a counselor to sort out your own experience and how you're reacting.
I would like to thank you very much for coming on. Is there anything else that you think would be important to pass on at this time about what has happened?
I just encourage everyone to reach out for help, that these events, it's hard to imagine they'd happen in our own backyard. Just try to sort out your own experience, increase your sense of meaning in the world and your own sense of safety and purpose.
If you would like to contact Dr. Marjorie Geis, you can contact her at 805-899-4940. There are services at Santa Barbara City College. You can contact them by going to 805-893-4411. They are going to be there 24/7 at this point in time, and also at UCSB for both students and parents. Their contact number is 805-893-3901. And then, of course, there's the Santa Barbara Resource Network, and you can reach them at their website by going to sbresponsenetwork.org. And I will, of course, post all of this on my website at drkimtaylorshow.com. We will be right back after the break. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. We are on the phone now with Hannah Beth Jackson, who is a member of the California State Senate. So welcome to the program.
Thank you, Dr. Taylor. I'm delighted to be with you.
Senator, what I know is that I have these three things that I really want to talk to you about and to get your comments and thoughts about. The first one is that while parents were concerned enough in this case to call the police and to report the need for what's called a welfare call or a mental health call, what happened is that the police went out to talk to him, but they found him to be very polite, lucid, and therefore not the typical person that usually has a mental health problem. So my question is that since they didn't present in this way, they were not able to then search his home. But shouldn't it be that a person who has a call out on them, who parents or friends or someone has called and said that they really feel like there is something going on, shouldn't the police be able to do a search and to have that worthy of making it a probable cause to conduct that search and or to obtain a search warrant to do so?
As I understand it, as you mentioned, this young man presented very calmly. He was very polite, very present. And yet, you as an expert could probably spend 5 minutes talking to this young man and recognize that he had some serious issues. Mm-hmm. In addition, what was it that sent the parents or to the police? What did they know? What did they hear about? And were the law enforcement officers sufficiently sophisticated so that they could pursue this further? Because yes, had they delved further into this man's behavior, had they seen any of his YouTubes, if you will, the videos that he was shooting, they may very well have recognized that this was a dangerous young man and pursued it further by asking if in fact that they could search the premises, and if not, then get a probable cause order for a search warrant so that they could do so at that time. Mm-hmm. But I suspect we're not well trained, and frankly, part of the problem is that when it comes to mental health, we're still far too much in a less than well-trained kind of sophisticated fashion to recognize these problems, whether it's when law enforcement confronts somebody who's homeless on the street, not recognizing that they may have mental illness problems that need to be treated appropriately, even on a contact on the street with someone that we know has issues. Our mental health training is woefully inadequate. So I agree completely that we should be able to do more, but I think it also requires that we have better trained people out there who are doing these investigations.
Well, that is a great point too, but I think at this point in time to be able to change the law, to just make the fact that a mental health call for the police to go out should in and of itself be worthy of perhaps the probable cause to do a further search within their home too.
The question becomes, well, you know, is that an overreaction? Is that a violation of that person's right of privacy? Is that a violation of the Fourth Amendment right against illegal searches and seizures? Are we going overboard? Those are the things the questions that would be asked, and those are the things that we have to balance.
Mm-hmm. So here is number 2. This young man was 22 years old, and so therefore he was of legal age. And so there was not a lot that the parents could actually do with having real proof. But since he has a history, he's had multiple treatment, it sounds like, and that he does have a history of problems connecting with others and poor judgment, perhaps even being angry, that it seems like we should change the law so that the parents can seek to obtain a legal conservatorship much easier in the court system than they are able to do now, especially when some of these points are present.
I agree. I think that that the bar that we have set to create conservatorships of people have been overly restrictive, and that what we need to do is go through that whole process and reevaluate when we determine legally that a person should be under the protection of a conservatorship. This is an issue that has been hotly debated. The more we have become knowledgeable and more sophisticated about mental health, this is a discussion that absolutely we have to have, because, as you point out, many parents are absolutely helpless when it comes to addressing the mental health problems of their children, whether they're younger, younger meaning they're over 18 but they're still in their 20s or 30s, or whether they're more senior children. We see this throughout the spectrum of young people and older people with mental illness. being out on the streets and in danger for their own safety as well as the safety of others, and we can't, as parents, do anything about it. And that, of course, is something that has to be reviewed and changed so that we are able to give the care that's appropriate for those mentally ill people.
Okay, and my third one is that, this is the big one, right now, as an adult, the law states that anybody has the ability to acquire firearms. It seems at this point in time there has to be a change in the law that in order to purchase and own firearms, a person must get a license and to go through a more strict class and testing process, as well as to submit to a psychological exam. That they should have to have just more strict rules around this. This is not to say that they can't go and use them at a shooting range and to do it under the supervision of a trained expert. But if they want to own and possess a gun, then they must get a license, and it has to be more stringent.
Well, of course, in California, we have the strictest gun laws in the country, which require that to purchase guns legally, you have to register the firearm, you have to get a license for it. What we are lacking is the mental health testing, and I couldn't agree with you more. That people should have to go through some kind of a critical procedure to determine whether or not that they are a danger. And adding to that danger, exacerbating it by having access to firearms. So that is something that I am hoping to take back to Sacramento with me and to try to push that issue forward. I'm sure we're going to hit lots of obstacles and protestations and all this Second Amendment stuff that has really made it so difficult to properly regulate and gain some kind of, I guess the only word for it is common sense when it comes to firearms. This whole notion of the Second Amendment right, as Christopher Michaels Martinez's father, one of the young men who died, who was shot to death, mentioned, didn't my son also have a right to live? That's his right, and that was denied to him. So this is a debate that's going to continue for some time. As an active member of the Coalition Against Gun Violence, it's a discussion that we have to keep having until we change some of the insanity that we're seeing here in this country today with the proliferation of firearms and their use on innocent people in our state and our country.
Senator Jackson, I want to thank you very much for taking your time to come here and to talk to us about this. And I will make a deal with you. You go and do your work there, and I'll keep doing my work here, and maybe we can make something happen here.
I hope so, and you've got a deal.
Thanks again for being on the show. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. Grief. It's a deep emotional response to loss, and it may take days, weeks, or months to resolve, and everyone's experience of trauma is different. We want to make sure that those who do need our attention get the help they need, and that we work to support them through this time of tragedy. Yes, we will rise above this young man's actions and our community's tragedy. But how many more? And how many more parents and brothers and sisters and friends and family and children must suffer for us all to learn that when one suffers, we all suffer. We are together only as strong as our weakest members, so helping those in need helps us all. Reach out, help those in your circle, be present for them, stay in touch. Take the time to connect and show up for them in a loving way. People do have emotional problems in life, and we need to be able to take away the stigma of mental health and provide the necessary help to those who are struggling in order to make them well. So let this be a call to action, that reaching out to those in need before they hit the crisis button is what we can do to change this course. I want to thank my guests today. First, Dr. Gil Reyes, who is a warrior out there doing really good work with those who have suffered trauma. in order to help them to get back on track in their lives. And also I want to thank Dr. Marjorie Geis for her wisdom and her help in sorting through when and how to get help. And lastly, I want to thank Hannah Beth Jackson, our state senator. What I know about her is that she is a fighter. And no matter what side of the political spectrum that you may be on, know that this woman cares about these issues and will be out there fighting for this cause. I want to let you know that there are local and community resources that are responding to this. One is Santa Barbara City College, and this is going to be for both students and parents where they can talk to a counselor to get help. There's also UCSB for both, again, students and parents. They have also set up emergency housing for any displaced students, and they have a hotline number. And then there's the Santa Barbara Resource Network, and they can help to coordinate interventions and support for those who have been affected by the Isla Vista shootings. So I am going to put their phone numbers and websites on my website so that you can go to just one place to get all of that important information. So just go to drkimtaylorshow.com and it will all be posted there. I'm going to be back here next Thursday afternoon between 2 and 3, and I really hope that you will be here too. This show will be able to be heard in a rebroadcast tonight at 10 p.m. and then Sunday at 9 a.m. right here at KZSB AM 1290. So if you have any questions or if you want to just talk to me, send me an email at drkim@drkimtaylorshow.com. I want to leave you with the words I saw on a sign at the site of the tragedy that really sums it all up. It was left by a young college student, and it read, "Be kind to each other." I'll see you next week.